to the Nutrimedical Report for Thursday, the 18th, and we did have a caller, Henry, that called in the third hour yesterday. The rules of calling in are you have to stay on topic. If it's open lines on any topic, which it is the first hour today, you can call in a wellness issue, geopolitical, spiritual, any issues you want to talk about, but do tell the board op exactly what your question or statement is, and be very particular in terms of the questions. No ad hominem attacks, but you can attack issues and ideas. That's very important. And the most important thing we ask you to do here on the network is not to believe anything we say or document, but to research it yourself and to ask better questions. So it's very important for you to understand the rules of the road here. We did have Henry call in yesterday. On the third hour, we were talking with Clint Richardson on various issues such as the straw man, his website, the Corporation Nation, and he has a show over in Republic Radio, a very important program. So I want to start off with some of the latest news that's going on in terms of what's happening. I just had a discussion today with our nuclear expert, Chris Harris, and they're slowing down the removal of fuel rod assembly bundles at Fukushima Daiichi because they don't have a place to put it in a common fuel storage pool. And, of course, we'll expand on that in the third hour today, but the issue is nowhere around the world do they have a permanent storage facility in any country for nuclear waste. So it's literally stored on site for the last 50 to 60 years plus all around the world, like in Switzerland, Britain, France, Spain, the United States, Canada. All the nuclear waste is being stored on site. There is some side waste, for example, from Canadian nuclear reactors that generate depleted uranium. It is literally shipped at night, occultly, to the United States to be shipped to create depleted uranium munitions that ship back to places like a facility in Calgary, Alberta, where DU munitions are made for the Israeli government. People need to be aware that a lot of things that are happening, such as switching to MOX reactors, sponsored by the senator from South Carolina, is a very evil thing because these are dangerous reactors that run hot, but they're also dangerous in terms of generating plutonium detonator pellets for nuclear warheads. The Russians just announced they have 40 nuclear missiles that have multiply targeted warheads that they've just added to their stockpile this last year. The moves by Obama have pushed us closer and closer to a possible future nuclear conflict with Russia and with China. Even though we're doing war games with China right now, they're doing things in the Spratly Islands, which are very concerning. And we are not operating from a position of strength, so that we have a extremely poor leadership in the so-called federal government by Obama. We call he's not so much of a closet commie, he's a full-force commie and Islamic, if you want to call it, apologist, supporting ISIS and ISIL, and we have tons of evidence to prove that, so it's not speculation. I want to touch on some of our latest, and I'm going to be posting up probably over the next couple of days a number of new protocols for wellness that will help people to understand how we approach things and the latest updates. And, of course, a lot of the protocols are significantly updated in terms of what are my approaches to specific health issues. And we are now connecting with many more clinics. I've had a number of requests for people to have clinics in Mexico for cancer treatment. 3 major clinics that I've been in contact with. The Isles one was the quickest answers. That's ISSELS. And I talked to Anna Marie Isles, whose husband founded the clinics in the 1950s in Mexico and Germany. Their son actually operates a gene-directed cancer clinic in Santa Barbara, and they have an affiliate, Dr. Kim, in Riverside at the Loma Linda Hospital for Seventh-day Adventist Loma Linda Hospital here in California. They have the Coley's vaccine and the dendritic vaccine and a number of other therapies such as hyperthermia. The dendritic is one of the most exciting because they actually take the RNA of the cancer and immunize or amplify your white cell clone to actually attack the tumor. So it's like a directed tumor vaccine that's customized to the individual person. And that takes several weeks in the laboratory to create, but they're very effective. Their costs are pretty reasonable, and if people contact me, I can give them information. I'm waiting for information from BioCare and from the Oasis of Hope clinics as well that have similar treatment programs in Tijuana. Many of these treatments are not available in America, although they have done research on granulocyte therapy, where they take granulocyte white cells out from a first-degree relative. They started work on animals probably 15, 16 years ago, and were very effective at literally turning off and attacking any cancer and got 100% cure rates. So I think that the idea of cancer vaccines, intravenous Laetrile, hyperthermia, again, I tell everyone they should be on our Nutrimed line of nutraceuticals to fight cancer, including malignant arrest, malignant block, ellagic acid, Inflamex, cell defense, Myco D2, etc. The full protocol, no matter what cancer you have. And then when you use these other augmentation therapies, you have tremendously higher success. I do not recommend radiation or proton therapy for anybody, or non-gene directed chemotherapy, or non-chemotherapy where these are not chemo drugs. You want to do the gene testing. There's a specific facility up in Cambridge, Massachusetts that does very advanced gene analysis of your cancer. So that's the latest, because I'm getting a lot of requests in that particular area. Recently had a request for someone regarding ulcerative colitis, and one of the things that people say, one of my individuals that I send this protocol, they're worried about swallowing a number of pills a day. You don't swallow pills. If you can't swallow pills, what you do is you grind the tablets and you open up the capsules and make a smoothie, and the ideal smoothie would be a combination of ageless and life support. So it's important for people to understand that if you're trying to control a condition and you don't want to swallow pills, because a lot of people are pill phobic, that's the approach you take. For example, for ulcerative colitis, you want to use gastrohealzine carnosine to heal the gut wall, cell defense, which is an anti-inflammatory, with curcumin, berberstatin to kill off the stealth pathogens present in the gut, along with allicin med and Nutrimedical. Living probiotic to recolonize the gut with the Roselle 6 strain from Paris, and Living Probiotic Ultra every second day. Nutriimmune, which is immunoglobulins, similar to intravenous immunoglobulins. In fact, I read the article an hour or two yesterday about the use of IVIG to protect people who have immune deficiency or are poor responders to vaccines. As I've said from Tatiana Ogabanovich, that the whole idea of forced vaccinations is obscene. The state governor and the people sponsoring this bill, the doctors, the hospital clinics, etc., will all be sued, and there'll be significant fines and or jail time for the people involved with trying to do medical assault. So they need to understand that we're not going to put up with this, and the science is not there. And if they want to develop a lifelong immunity, they need a whole different approach. We will be launching a nutraceutical formula that's been in the works for years, that has immunoglobulins and transfer factors in a capsule form within probably by the end of the summer, and people can take this and actually block the 26 major pathogens that affect humans without any toxic adjuvants, without any genetic material, without any heavy metals. So that's going to be available in a couple months. Also, for people to try to overcome inflammatory colitis, you want a lactose blocker, Allergon and Allerblock. The lactose blocker will block milk sugar because it's in a lot of different products. You want to be taking a malignant block, of course, and ellagic acid to heal the gut wall, and Calm Mind to calm the gut, and magnesium glycinate malate, which is an anti-stress, anti-inflammatory, Power C Plus, and full vitamin K2. The person that requested this was concerned that the number of pills they're going to have to swallow per day. I tell people don't. When I make my daughter's smoothie, I open all the capsules for her. She just simply drinks it down in 30 seconds, and she has all the capsules without any choking or swallowing. And if you mix it with Ageless, Life Support, NutriComplete, or Glycemics, it's easy to go down. So you get a Ninja blender for the major smoothie, and then put it in the capsules and use a hand blender, and with each batch that you want to make each day. And it's very simple. Don't swallow pills. Just drink them as a smoothie. Back in a moment. Your questions, 800-259-5791. And welcome back. And, of course, talking about health issues, a lot of people are trying to struggle between whether they should listen to the primary care doctor or surgeon, or even dealing with issues, say, with their pets. Recently had a situation where someone that I know very closely, had a pet that started to develop seizure activity in a toy dog. And, of course, the differential diagnosis, and this is before you get the MRI back and the tests, etc. Little dog, unfortunately, deteriorated significantly and ended up being put down. But the situation was this. When a dog is exposed to toxins, let's say if you're clearing pesticides around your building, they can be poisoned. And number two, the most likely thing in a young pet, in a pet that's reaching their advanced age, and this pet was around 10 years of age for a toy dog that's pretty old, they can have sepsis. And the most common sepsis is sinus, lung, and or brain sepsis. And if you see seizure activity, you have to assume a form of bacterial, mycobacterial, fungal, or viral meningitis. Oftentimes the cultures will be negative, and they will not give you an idea as to what's going on. So our antipathogenics work on that as well. And that's important to understand that Nutridyne, Alamax, Alamed, and our antipathogenics are very effective at knocking off, and Silver 100 knocking off pathogens. So that's important to realize that a lot of times sepsis is a major cause. As I say, if you hear hoofbeats, I learned this many years ago, it's most likely horses and not zebras. One of the more common questions we get asked is elevated PSA, prostatic specific antigen test. I recommend that males only do the test with a free and combined PSA, which your insurance will cover. The test is about 3 times the cost, but insurance covers it. And it will tell you whether it's a benign enlargement of the prostate or a cancerous enlargement. If it's a cancerous enlargement, even a rectal exam may not pick it up. The best test to do after that, if the PSA is elevated, is to do a transrectal ultrasound and a needle biopsy, a transrectal needle biopsy with a prokaryotype analysis by a pathologist. If it's positive and you determine that it's passed through the Glisson's capsules, I recommend firstly the clinics in Tijuana, Mexico with our nutraceuticals. I do not recommend surgery unless it has significantly causing either obstruction of urine or causing other problems such as obstructing the body cavity or the bowel. I think that you want to do vascular sparing surgery if you do it. Our nutraceuticals for protecting against a PSA elevation and benign prostate are Prostate Flow, 2 soft gels twice a day until the problem's settled, and then back to 1 twice a day. Vision Max, a capsule twice a day to reverse the chances of cancerous transformation, and Nutra Defense, a capsule twice a day. Xenoestrogen Detox to remove the xenotoxins that make the prostate gland tissue grow and can induce cancer. Malignant Block, 2 capsules twice a day, and the Ellagic Acid, 2 capsules twice a day. It'll take precancerous changes and repair the DNA or make the cells go through apoptosis. Keeler Max to remove the heavy metals concentrating in the prostate. Inflamax to strip off the capsule of any precancerous tissue and reduce prostatic inflammation. Myco D2, which again will boost your natural immune system along with NutriDefense. And Nutriodine, 15 drops in water 3 times a day. Bladder Up and Swedish flower pollen for restoring normal bladder and prostatic induced activity in terms of controlling the bowel and the bladder activity. Bladder Up, soft gel morning and night, and Swedish flower pollen 1 to 2 tablets 4 times a day. In terms of therapies, I recommend the micropulse and lumen photon. You can put it over the perineum, and it'll help significantly reduce elevated PSAs. And other therapies that are helpful are mild hyperbaric oxygen therapy. If a test comes back positive indicating cancer, I recommended the gene-based cancer therapy, probably at the Eisels Clinic with Dr. Eisels in Santa Barbara, and the dendritic vaccine at their Tijuana Clinic would be the first approach, along with IV, with the Coley's vaccine and hyperthermia and other types of treatments, which will augment the body's ability to fight the cancer. The gene-based therapy basically determines which genes are turned on that causes the cancer, and we use off-label uses of standard drugs and or very low dose of chemo that works directly against the tumor. Most of them are off-label use of other drugs at very low dosages to turn the genes back to normal. And this is very effective. It's combining not only the work at the Brzezinski Clinic, but goes beyond that to add a number of augmenting therapies, such as mild, what's called low-dose insulin therapy to augment the absorption of the nutrients into the cancer tissue. because it augments that therapy dramatically. So elevated PSA, that's how I approach it. It's combining the best of medical care and the best of functional medicine and advanced cancer treatments inside and outside the United States. The people who have purchased an 8D LRIS and are wanting a full evaluation, they don't need to be concerned about the cost of paying for a consult form. That's included in the cost of getting their machine for themselves and their family for a number of consults. And what they should do is fill in that form, because it makes my report much more analytic. Attach any MRI, CT scans, blood work, etc., and then I will log on to a TeamViewer 10 and look at their data. And I can actually section through all the different organs, do frequency analysis testing remotely. So it doesn't matter where in the world they have their 8D LRIS, I can log in and actually look at all the data and the organ sections right down to the individual cells, and will then give them a diagnostic distillation of all that data together to tell them what's wrong, whether they need to have specific secondary testing done like MRI, CT scan, electroencephalograms, blood tests, genetic tests, etc., and which nutraceuticals will be appropriate and what other types of therapy, including surgery, is appropriate or specific specialists. So I provide that after we get that off, and recommend that they also have a QRMA so they can look at their nutrient status as well. The issue of multiple sclerosis is a big deal. And when people are treating multiple sclerosis, you're also killing off pathogens. We think that MS is triggered by a Lyme or Lyme-like parasite, such as babesiosis or ehrlichiosis. And the cross-reacting antibodies attack the oligodendrocytes that create the myelin sheath around the nerve fiber tracts, specifically in the posterior columns and the corticospinal tracts that regulate motor activity. So we start off with NutriDefense and NutriFos to remyelinate, Sphingolin, Copper Regenamax, and Neurogen. These help to remyelinate, along with the Sphingolin, which is myelin basic protein. We want to turn off the free radicals, which is cell detox glutathione for getting hydroxyl, and carnosine for cyclid oxygen. We want to remove any heavy metals with Kilormax and ultraliquid zeolite. We want to kill off stealth pathogens with Allicin Med, Nutriodine, and Silver 100. And we want to, as I said, to re-energize the remyelination process with Omega Supreme Krill, raise neurotransmitter levels, especially dopamine, with BioLVR and Neurival, which is acetyltyrosine, and replace all the minerals that are deficient as we chelate with Vitamin Max Minerals Plus, alkalinize with Power C and full vitamin K2, and repair the DNA with ellagic acid. So this is very effective, but it'll buffer. Recently had an owner of a pet dog who wanted to make sure they protected their animal from the toxic effects of the rabies vaccine. And I recommended that you want to use the very powerful antioxidants to stop free radical damage and immune damage. So you can open capsules up of NutriDefense, Regenerex, Cell Detox Glutathione, and Carnosine, and you can actually, depending on the weight of the dog, you divide the weight by the adult weight. So, for example, if a human would take a full capsule and the dog is, say, 75 pounds, you give it half the dosage. And the idea is that you give this before they're exposed to the vaccine, and probably every 4 to 6 hours after that during the day for the next couple of days, to try to block the negative effect of the toxic effect of the adjuvants, causing free radical damage and perhaps heavy metals or other exposure. If you think there's heavy metals in the vaccine as well, you might add ultraliquid zeolite, which is also very effective at grabbing the heavy metal toxins, or open a capsule of the Kilormax. So it gives you an idea. Yes, you want to protect them, and as we had our discussion yesterday, vaccines are not justified to force on anyone, especially children. Diverticulosis is a very big problem, and we get a lot of recurring calls over it. I tell people the first thing you want to do is you want to clean the lower colon. You can have high colonics, but the most important is colon cleanse. Living Probiotic, which is a Rizal 6 strain from Paris. Living Probiotic, also the most powerful we have available. Gastro Heal, which is Incarnosine, and IBS Care, which normalizes peristaltic movement of the bowel through the slow release of carnitine. Allicin Med, Nutriodine, and Inflamex to reduce and break down the we call non-digestible fiber in the fecalus in the lower colon. So that's a very helpful protocol. For testicular inflammation, often we'll have people that have epididymitis or other problems. We recommend Prostate Flow, 2 soft gels twice a day, Vision Max, a capsule twice a day, Allicin Med to deal with low-grade infection in the epididymis. Inflamex, 3 to 5 capsules twice a day, and Nutriodine, 10 to 15 drops 3 times a day in water. Locally, you can apply the Lumen Photon on setting number 7 for pain and setting number 4 or 5 for healing or regeneration. We often hear people having questions of heart problem with arrhythmias. The first thing to do is you've got to optimize magnesium levels of magnesium glycinate malate and magnesium taurate. The most tolerated is the magnesium glycinate malate, and usually we'll titrate the dosage up to pretty high dosage, for, around 6 capsules twice a day for a man and 4 twice a day for a woman and then 3 of the capsules of the magnesium taurate and 2 of the magnesium taurate for women twice a day. Forskolin, which is Coleus forskolii, Cardiovasc, our heart formula, both the 15 drops to 30 drops 3 times a day, depending on weight. Gamma E plus to repair the ion channels. Ellagic acid to repair the blood vessel walls, which has been proven to actually normalize the blood vessel wall of people that have been damaged by chronic vascular disease. CoQ10 Supreme and CoQ10 Ubiquinol. The Ubiquinol is more absorbed than the CoQ10 Supreme and will back convert to the CoQ10. It's really important to have both. VascuCare, which is the propionyl L-carnitine to restore normal metabolism to the mitochondria in the heart and blood vessels, and Omega Supreme Krill and Omega Supreme. The krill oil has astaxanthin, which is very helpful for protecting the artery walls and the heart from arrhythmias, and the Omega Supreme Krill will reduce the chances of vascular clots due to a stringy clot developing in the atria if there's atrial fibrillation. So that's very important. I recommend anti-clot mechanisms using nattokinase, usually a capsule 3 times a day to 2 capsules 3 times a day, and lumbrokinase, 1 capsule 3 times a day if there's proven problems either on a transesophageal or echogram of the heart, or previous problems with deep vein thrombosis, or proven problems with vascular disease where there's proven plaque or partial blockages. I would add to the nattokinase lumbrokinase. And you can do a Rheologics blood test, that's RHEOLOGICS, and it'll determine if your blood viscosity. The other tests are high sensitivity C-reactive protein, and more sensitive yet is called a PI1, plasminogen activator inhibitor 1, developed by Dr. Sumi in Japan and Dr. Holsworth here in America. The research on the use of nattokinase. So it gives you an idea of the kind of issues that we have to deal with there. Let's see. We have an interesting consult request regarding sexual dysfunction and erectile dysfunction. The first thing we recommend is normalizing male hormone. Men's Max, 4 capsules in the morning. Hormone Synergy, 2 capsules in the morning, to prevent male hormone from being converted in your adipose tissue to female. Vision Max, a capsule twice a day. Supernox to raise nitric oxide, which is normal for erectile function. Neurival to increase dopamine, which also helps improve erectile function. Enhance for men, 1 capsule twice a day. DHEA, 25 milligrams, 2 tablets in the morning for men, and 100 milligram, 1 tablet of pregnenolone. Microdose, which is a growth hormone, before exercise and before bedtime and first thing in the morning. Mountain Red Velvet, a capsule 4 times a day, and I recommend opening it, and that will improve male hormone function. You can measure at directlabs.com male hormone and female hormone levels, and it'll determine if you're in the proper range, that you're not bioconverting to female hormone. If you're trying to remove the xenoestrogens from your body, you want to use NutriDefense and Xenoestrogen Detox and SEM-ethyl, acetylmethionine. So you start off with BioLVR, SEM-ethyl, superfolate, pyromethyl B12, and the use of the life support is very good for phase 2 detox. But it's important to remove the we call xenoestrogens, which are molecules that lock on the estrogen receptor hundreds of times more avidly than estrogen, that can feminize males and can interfere with sperm count and sexual function, because there's a lot of feminization occurring since the Second World War with increased xenotoxins present. And when you have a concern regarding a relative that has a significant heart and vascular disease, we always start off with Cardiovasc, Supernox, Omega Supreme Krill, Omega Supreme, Gamma E+, magnesium glycinate malate, magnesium taurate, VascuCare, CoQ10 Supreme, and CoQ10 Ubiquinol, and and perhaps Forskolin if there's cardiac arrhythmias. and they should have a significant improvement in function. You can do a transthoracic or transesophageal echogram, a heart wall motion study. I don't recommend the CT scan because they're very high levels of radiation, 500 times the chest X-ray. I do recommend a treadmill stress test, which will pick up 83% of people with significant vascular disease, and a high-speed CT scan, which is very little radiation for 8 seconds, that'll show calcium scores. And if you're taking the right nutraceuticals, including full vitamin K2, you can reverse the calcification of arteries, along with, as we say, Neurogen, which is docosahexaenoic acid, Omega Supreme, krill, and our other nutraceuticals we just mentioned. We had someone raise an interesting question about the estrogens in cheese. There's not estrogens, there's molecules that are glutamates. And glutamates are stimulants, so they tend to make people behave like they're addicted to it. But there's a lot of foods that contain glutamates that are naturally present in foods, and I don't think it means you should stop eating cheese. Cheese, if it's organic, is good for you, especially if it's raised on animals that are eating normal, grasses and so on, so they'll have conjugated linoleic acid. So if you have an organic cheese that's, raised where the animals are not having grains, but they're having actual grasses, they'll have CLA, which is helpful to your heart and blood vessels and brain. Our basic heart protocol, of course, includes cardiovasc, gamma A+, supernox, magnesium glycinate, omega supreme krill, omega supreme ellagic acid for repair of the artery walls, vascular CoQ10, ubiquinol, cell detox, glutathione, carnosine, and NutriDefense. Very effective for reversing that problem for heart problems and restoring. And you can measure nitric oxide in the back of your tongue with Berkeley test strips. So you can determine that, and there's other testing that we can make available for you. You contact me that can tell you if you've improved perfusion of your tissues, because that's the goal. It's not just getting your blood pressure down, it's improving the perfusion to get nutrients and vitamins and minerals to your tissues and pulling out the toxins. It's much more advanced than just measuring blood pressure. We'll be back in just a moment. Your questions, 800-259-579. And welcome back. And one of the more common questions we get is chronic fatigue and autoimmunity. Chronic fatigue syndrome basically usually means it's a stealth infection like Incline Village, Nevada, HHV6, cytomegalovirus, etc., mycobacteria. Most people don't realize that cancer and autoimmune diseases involve two things: stealth pathogens and toxins. And they can be radiotoxins or halide compounds or all kinds of different nastiness. And it's important to understand that we first want to correct the brain function, because the brain and, of course, the mitochondria in the brain are affected. So cognition plus, brain power, and synaptin. We want to control the energetics of the brain, so we want to improve CoQ10 Supreme, CoQ10 ubiquinol, which is a reserve form, vascular, and Neurival to raise dopamine levels in the brain. Chronic fatigue syndrome, especially in MS or chronic fatigue syndrome, Neurival, which is acetyltyrosine, helps dramatically. You want bio-LVR to restore neurotransmitter levels, Allicin Med to knock off the pathogens, Nutriodine, and Silver 100, mitothyroid for mitochondrial dysfunction of the thyroid, and of course selenium cruciferate for thyroid dysfunction, and to stop free radical cell detox, glutathione, Regenerex, and Nutritrala, and a carnosine to stop singlet oxygen. Power C+, and vitamin K2 will alkalinize, because when you're in an alkaline state, pathogens basically cannot coexist, and the body can start to repair itself and raise the redox level, and the vitamin K2 in ellagic acid and malignant block will repair the DNA. So chronic fatigue syndrome is very easily treatable with no drugs. All just are antipathogenics. Mitochondrial support, you can add mitochondrial catalysts and uridine to raise mitochondrial function. We have a very common request for diabetes. We have dibetaline, Minerals Plus, leptin metabolic, lipoflush, carboblock, chromium cruciferate, and glycemex. And we very regularly reverse diabetes. You have to also understand that you're dealing with elevated levels of glucagon, and taking carboblock is extremely important, along with lactose blocker, because if your lactose is glucose and galactose, and if there's present in your bowel, you're going to get a dysbiosis. It'll raise liver and kidney levels of sugar production through gluconeogenesis. So that's why we have the thing called the Smogy effect, where your blood sugar is normal when you go to bed, dives real low in the middle of the night, and shoots up because your glucagon makes your liver and kidneys make sugar from protein. Very commonly we get requests regarding depression. Depression, of course, responds to bio-LVR, Calm Mind, Brain Mag, and Posinol. And if we have to, we add to that SAM-ethyl, acetazomethion, superfolate, and pyromethyl B12. The activated B6, B12, and folic acid, the calming effects of Calm Mind and Posinol, Calm Mind containing bioinositol, which is a special B vitamin, sunthein, L-theanine, and GABA, which is a postsynaptic inhibitor. Brain Mag, which is the magnesium L-threonate, works particularly on the brain tissue, protects the brain from S100 proteins, upregulation of microglia post-vaccine. So if you're trying to protect a child who's been vaccinated, you want to use Brain Mag and the Calm Mind combination. And by the way, it'll cut down on addictions for alcohol and other things, so people can go back from drinking a bottle of wine to drinking maybe a glass now and then, but will not be addicted. Same way with overuse of marijuana or other mind-altering drugs. You can calm yourself down so you're not requiring that addictive pattern. Posinol, very good adaptogen for depression as well. So depression basically is the seizure activity of the limbic system of the brain. The surface EEG does not pick that up, but their deep brain activity can see a change on their SPECT blood flow scan of that parts of their brain. So if they do a SPECT scan or a positron emission tomographic scan, which I've done, you can see a difference. So nutraceuticals make the difference. Drugs don't. They're dangerous, and you want to avoid those. I've had some confusion over people that want to know about the consultation. Consultations, email or phone, basically are for our non-elite customers are basically only if you send me a ton of records. Most of the time, 99% of the time, I will give you a quick answer to a protocol, just like I did with our person earlier yesterday that requested a protocol for ulcerative colitis, and they were concerned about the number of pills to swallow. Firstly, I tell people that are pill phobic, don't swallow pills. Open the capsules up. It's pretty easy. You can even open them up and make enough supplement and mix it for an entire week or month, and just take out a measured scoop of the supplement and mix it up in a smoothie with a hand mixer. After you have your major, blended up, say the Ninja blender in your refrigerator, which is what I do. So 2 or 3 days will last the major formula. So when I give my daughter her formula for her Down syndrome, she basically is getting open capsules and punctured soft gels like Neurogen in a smoothie, and she can down it in 30 seconds, and it tastes great. There's no weird flavors. There's no sticky, lumpy things because it's all been blended nice and smooth. The consultations, the reason why it's important is because we have a PDF form, and by the way, if you're an elite customer, if you have an ATLRAS or a QRMA, there's no charge for you doing consults for 6 consults for the QRMA. After that, there will be a small charge if you send a lot of records to do so. The form is extremely important, which I recently posted up because it helps me to get a much more rounded medical history rather than you just, producing whatever history you think might be relevant. There's a lot more questions I need to ask that are going to help us tremendously to get a better response. Also, do not try to fax any records. Send them as an attachment, either scan reports, lab reports, and or even images. If you want me to look at images, MRI, CT scans, EEGs, EKGs, treadmill stress tests, genetic analysis. And if you do send genetic analysis, send the not only the 23andMe, which is my favorite, but also send the Prometheus. And don't send the entire Prometheus file, just send the file dealing with the specific genetic anomalies we're going to look at. So all the ones that deal with everything from hair color and so on we're looking at metabolic disorders like folate reductase imbalances or other problems of bioconversion of activated supplements and nutraceuticals that your body needs, where even good organic food, your body has genetic or toxic blockades because of biotoxins that are blocking the conversion. And that's a real common problem because now we don't only have genetic load, we have that problem too. Mold recovery is a really big issue. We talked about this before. You need to get Power C Plus and full vitamin K2 to get the body alkaline. Our antipathogenics Nutriodine is serious, 10 to 20 drops 3 times a day. Sinupulse Elite. Everybody with chronic mold has it in their sinus and their airways and their GI tract. And there's a number of antigens that cross-react. There's 93 potential antigens in all molds. And a number of them cross-react, whether it's Candida albicans, Tropicalis, or glabrata, tree smuts, or other fungi, such as Herbarium, Stachybotrys, etc. So it's important to understand that they all cross-react. So we need to clear the pathogens, use Allicin Med, and of course Silver 100. We want to repair the cell membrane, so we need Nutrifos, Neurogen, and Omega Supreme Krill. We need to replace the minerals as we detox, Vitamin Mineral Max and Minerals Plus. We need to repair your DNA with ellagic acid, Malignoblock. And we need to repair the brain function with Cognition Plus, Brain Power, and Synaptin. And we need to stop the free radicals with Nutritrala, Regenerex, Cell Detox, Glutathione, and Carnosine. And repair the neurotransmitter levels with BioLVR, Neurival, which is acetyltyrosine. And we need to add superfolate, pyromethyl B12, and methylation support with Methyl. And remove the xenotoxins, because a lot of the mold toxins are actually xenotoxins as well. That'll be Xenoestrogen Detox and NutriDefense as the most powerful catechin and antioxidant we have in NutriDefense. So mold illness will respond. There are types of long-acting type immunological treatments you can take through an environmental doctor, and I can direct you to how to get a doctor from our Academy of Environmental Medicine, but I find the nutraceuticals work fine. You don't need to go through treatments or injections. They will clear it up. And then we use mild hyperbaric oxygen, energetic therapy such as Lumen Photon and Micropulse Metathera and Exvitalizer. And of course, we can now set up the Exvitalizer as a morphogenic field therapy with the 8D-LRIS and the Metatron, which will be posted up today. And next Monday, I have Michael from China on talking about the latest on the QRMA, 8D-LRIS, and Metatron, and he'll be on next Monday in hour 4. So we will be back in a moment with Ryan Frace and Nutrimeds, Tim Alexander coming up in hour number 3, and Chris Harris popping in for a few minutes with an update on what's going on in Fukushima Daiichi and much more.